or non-oliguric. Oliguric means that they produce less than 500 milliliters of urine per day, while non-oliguric means that they produce more than 500 milliliters of urine per day. Although non-oliguric patients produce a large amount of urine, but it contains very little waste products, as the kidney hasn't filtered out the blood properly. Risk factors. Risk factors for developing acute renal failure include the presence of a chronic disease like kidney disease, diabetes, heart disease, high blood pressure, or liver disease, blockage of the vessels in the legs or arms, and/or a peripheral artery disease. Other causes can include bleeding, dehydration, increase in age, usually ages 65 and above, the usage of ACE inhibitors, overuse of certain over-the-counter painkillers such as NSAIDs like Advil and ibuprofen, and naproxen. Causes. There are 3 sites in the renal system that can get affected, causing abrupt renal failure. They are pre-renal, intrinsic, and post-renal. Pre-renal means before the blood enters the kidney. Intrinsic means within the kidney, and post-renal sites are where the urine leaves the kidney and enters the ureters. Pre-renal. If this part is affected, the kidneys do not receive enough blood to filter. The reasons can be dehydration due to diarrhea, vomiting, loss of blood or water pills, disruption of the blood flow to the kidneys due to various other reasons such as narrowing or blockaging of the blood vessel carrying the blood to the kidneys, serious injuries or burns, severe decreases in blood pressure after surgery involving blood loss, or bloodstream infections, especially sepsis, which can cause abnormal relaxation of the blood vessels and thus not enough pressure to bring blood to the kidneys. Also, liver failure, which can bring about hormonal changes that affect the pressure and flow of blood to the kidneys. Heart failure or heart attacks causing low blood flow. In pre-renal failure, the problem does not lie in the kidneys and they remain unaffected in the early stages. However, if the condition persists, they can damage the kidney tissue permanently due to low blood flow in the kidneys. Intrinsic. In intrinsic kidney failure, the problem lies in the kidney itself, due to which the process of filtration becomes faulty or ineffective. It can be a problem in the renal tissues handling salt and water processing, or it can be an issue in the supply of blood within the kidneys. These problems can arise due to glomerulonephritis, which is an inflammation of the initial filtration system in the kidney, the glomeruli. Acute tubular necrosis, in which the tubule cells stop functioning and eventually die. Most of the filtration process